GPs never know what's going to walk through their door. Unlike cardiologists, surely they know their patient has a heart problem. Or a dermatologist must expect to be looking at skin. But as GPs, we have absolutely no idea. One moment little Billy has a rash, next minute Susan's there with her heart attack, and then we're back to routine vaccinations. I call general practice the fruit salad of medicine, except for my fruit salad is a little different. I'm more of a two fruits doctor. See, I know what's about to walk through my door because the type of medicine that I'm passionate about is supporting and empowering people with their struggle in obesity. Now, if a fortune teller said to you today, I can tell you what age you will die, would you want to know? I wouldn't. I don't want to spend the rest of my life anticipating my premature death. But it begs the question, how long do we expect to live? Well, babies born in 1980, and I will use myself as Exhibit A, let's say 1980, we have a life expectancy of 79.2 years. And thankfully in Australia, that life expectancy has increased by approximately 51 days per year, arriving at today, where babies born in 2023 can expect to see their 84th birthday. Now you might think that's a really positive trend that we're seeing, but there's actually something very, very scary that's sitting in the background. We have an elephant in the room. And what I mean by that, as a euphemism, is that there is something glaringly obvious staring us in the face, yet no one feels comfortable to talk about it, and that is obesity. Anybody standing on this planet today with a body mass index of 30 or above is fighting for their life. Now that might sound dramatic, but it's actually true, because we know that patients who struggle with obesity have a reduced life expectancy of 7.8 years. Obesity is a chronic, relapsing disease, no different to any of the other chronic diseases that I treat as a GP. And so all of a sudden, in my field, I feel like that fortune teller. Back in 1980, when I was born, 85, the average number of people in Australia that were struggling with obesity was 8%. That figure today sits at 31%. So let me talk you through some of the factors that influence weight. And I'll start with genetics. Yes, the apple doesn't fall far from the tree when it comes to genetics. Some people have a genetic predisposition to gaining weight and others don't. It's no different to heart disease, diabetes, depression. If your mum or your dad, your grandmother or your uncle has struggled with weight, the chances are you are more likely to struggle with weight also. But here's the interesting part. The stigma that is directed at obesity is predominantly born from a bias that overweight people are overweight because of their poor dietary choices and laziness. And I've allowed that pause to give you time to think about how that sentence makes you feel, because I feel uncomfortable saying it, because I know it's not true. Now, if we replace the word overweight with one of the other chronic diseases that are accepted in society now, let's pick depression. And I'll read the sentence again. If a depressed person feels depressed, it's because of their poor lifestyle choices and laziness. Surely 31% of our nation are not letting themselves down. This is not an individual problem. There is more complexities to obesity than meets the eye. And two big drivers that we are facing today is social circumstances and physical environment. So some social circumstances that drive obesity, 3 that will come to mind: low education, unemployment, living alone. How many of us have come home into an empty house and thought, I'm not going to cook a roast with veggies, I'm going to nip down to the local fast food outlet and for $8 I'm going to buy myself a snack, because that is convenient and that is more economical from a time point of view and from a back pocket point of view. But the reverse is true. If you have a household that has 6, 7 or 8 people and you come home, all of a sudden cooking that roast and veggies is a much more economical way to feed your family. Other factors such as geographical and cultural issues drive our dietary choices. Depending on where you live in this country determines what you choose to put on your table. If you live remotely, the food that is available to you will be different to if you live in a metropolitan city. Some foods grow better in certain climates and others don't. Some isolated areas are restricted in the foods that are provided to the supermarket that makes available for you to buy. The Industrial Revolution, what a century that was. So many pros, but one of the cons that I'll talk about now is that the Industrial Revolution has made us less physically active. It has changed our lifestyles and it has changed our physical environments. We have more machinery and technology available to us today than we've ever had. The traditional urban design encourages us to drive our cars. And that creates more sedentary workplaces and more sedentary leisurely activities. Let's have a look at subdivision. Everywhere across Australia, we are subdividing land. Block sizes are getting smaller, some as less as 350 square metres, and we're plonking these massive mansions on top of them. And so backyards are disappearing. We're creating uninviting spaces for our children and ourselves to come home to. So our choices are to have leisurely activities inside the home. We know that social circumstances and physical environments are one of the main drivers for our decisions and our behaviours. However, people are more likely to choose healthy decisions and make healthy choices if they're enabled and empowered to do so. So when we're looking at interventions and management strategies to tackle our obesity crisis, what we need to realise is that these strategies should not be focused on an individual level. They should be focused at a level on social circumstances and the environments that we are putting ourselves in. And this is exactly the reason why when I have a new patient sitting in front of me at work who is struggling with their weight, I say to them this: this is not a you problem. This is an us problem. And it's that very moment in time where 9 out of 10 patients start crying, because they've spent 1, 2, 3, 6 decades of their life walking around with feelings of grief, shame, and helplessness, thinking that it's them that is the problem, when it's society and the culture that we have created. And it also gives reason as to why patients don't seek help for their weight. From the time somebody identifies their weight as being a problem to the time that they speak to their GP or their doctor about it, on average, is 8 years. Imagine spending 8 years or waiting 8 years to talk to your GP about your migraine, your chronic back pain, your infertility. It's absurd that we are allowing this time to pass and these patients to struggle without the help that they need. And so it gives rise to a cause for change. Well, what can we do to enable and empower these patients to seek help? First of all, we need to identify that obesity is no different to any other chronic disease in this country. It's no different to diabetes. It's no different to depression. It's no different to ischemic heart disease. We need to acknowledge, recognise and support it like we have with everything else in the chronic disease preventative stage. And so what we need to do is look at the treatment options. Allied health. Let's enable our patients access to a diabetic educator, a dietitian, an exercise physiologist, a psychologist. Let's promote weight loss medication like we do with other medications, blood pressure tablets, cholesterol medications and antidepressants. Those 3 tablets are the top 3 prescribed medications in this country. But if I can tackle the weight, I can reduce depression, I can reduce blood pressure and I can reduce cholesterol. Weight loss surgery, such a taboo topic, but it's something in my industry that I see profound improvements in patients' life and therefore their involvement within the community. So my call to action to everybody here, nationally and globally, is this. Next time you are sitting at your doctor's office, if you have struggled with your weight and you're standing up and about to leave that consult room, I want you to stop. Turn around and say to your doctor this: I'm going to book an appointment next week to talk about my weight. And 2 things will happen. 1, the hardest part of your weight loss journey has already happened. It's recognising that you need help and calling for that help. And 2, you're giving your GP 2 fruits. They are going to know next week that you are coming to talk about weight. They're going to be excited, they're going to be prepared, and they're going to be really, really happy to be part of your journey. And finally, I just want to give this statement or this sentence for you to ponder on. Imagine a pot plant sitting in your kitchen and this plant is failing to thrive. It's not flowered this season. Do you blame the plant? No. You simply must change the environment that that plant is in. You move it to the sunshine, you give it more or less water, you fertilise it, you give it a bigger pot. Everything on the planet that is living will benefit from a change in its environment. Thank you.